Good morning and welcome to South Australia's daily COVID update. First of all, can I say that we have the results in for yesterday, and we have 3,493 new COVID positive patients as of yesterday. So a slight uptick over the last couple of days, but certainly not the rapid rise that we've seen perhaps in some other jurisdictions. So 3,493 additional positive cases yesterday. Our hospital statistics ticked up also slightly to 125 now in hospital, but that's of course well within our current capacity to deal with. We still have 12 patients who are in ICU, same as yesterday, and one person who is on a ventilator, which is again also the same as the day before. So no increase in ICU, no increase in the number of ventilators, a slight uptick in terms of hospitalisation and a slight uptick in terms of the number of new infections in South Australia. Yesterday, despite the fact that 4 of the private labs in South Australia closed, we had an increase in daily testing. Up to 21,097 tests were taken yesterday, and we actually saw a reduction in our lab processing time by a couple of hours. So again, a massive thank you to SA Pathology, who again yesterday had to deal with an increase because of some of the private labs not being available. They were able to reduce their time and increase the number through the SA Pathology lab. I am informed today that 2 of the 4 private labs which were closed unexpectedly yesterday have now reopened, so that will again flex up our capacity in terms of testing. And further to the conversation that we had yesterday about the use of rapid antigen testing, which is now commonplace in some other jurisdictions in Australia, and I said that we would in the coming days be speaking more about the use of those rapid antigen tests. I can confirm that sometime within the next week we are likely to move to RAT tests for close contacts. So at the moment we've got plenty of PCR capacity within our testing system in South Australia, and so we are asking close contacts to have their PCR tests. We will evolve to a RAT test to preserve the PCR testing for those people that are symptomatic. And so we will, in the next couple of days, be messaging how this is going to be implemented. You'll still have to be put into the system. You'll go along and collect the PCR test, the rapid antigen test, and you'll administer it yourself and then pass through those details. And that will just be for close contacts, not those people that are symptomatic in the general population. They're the ones that we're really wanting to preserve our overall PCR testing capability for. In terms of the very good news for today's press conference, I've got to say I'm very, very grateful to the people of South Australia for lining up for their vaccinations. I think the last 2 or 3 press conferences I've been making a plea to people to go and get those vaccinations. Well, yesterday was a fantastic result, about 3 or 4 times what we've seen in recent days. And so, in fact, yesterday the vaccinations ticked up by almost 20,000 additional vaccinations in South Australia. And as pleased as I am about that, I'm going to tell you that I'm hoping for even more over the coming weeks in South Australia, and that's one of the reasons why we are flexing up the capacity of our vaccination sites across South Australia. Now, some of those are in our mass vaccination clinics operated by SA Health. Some of them, of course, are with our primary healthcare sector, our fabulous GPs and our pharmacies, and we saw big increases in both of those yesterday. So thank you to our GPs, thank you to our pharmacies in South Australia, and a massive thank you to everybody working within SA Health's vaccination clinics across the state. Yesterday was a busy day. I'm hoping that South Australia is equally busy. As many of our staff return, we can flex up that capacity. I know that there are bookings available online. People are telling me that they're booking in the morning and getting an appointment in the next couple of days. And as I said yesterday, one of the very best things that we can be doing at the start of this year is making sure that we can be as fully vaccinated as we possibly can in South Australia. One of the questions that's been asked at this press conference recently is about the vaccination status of those people in hospital. Whilst we provided some information on that yesterday, I thought I would just give you some further data regarding our ICU admissions in South Australia at the moment. It's a 50% of those people in ICU are unvaccinated. 50%. So this is a massive, massive overrepresentation of the general population. And again, I think this is the proof that we all need that vaccination is absolutely critical. I said it yesterday and I'll say it again today, that you can still catch this disease if you are vaccinated, but you're much less likely to catch it, you're much less likely to transmit it to a loved one or a work colleague, and you're certainly much less likely to end up in ICU or on a ventilator. So the critical message to all South Australians is vaccination is crucial. Please go and get those jabs in the arm and those boosters when you're eligible. This will be critical at making sure that we can save lives in South Australia. The only other stat that I wanted to give you today was we still are increasing, having an increasing number of workers within SA Health who are testing positive, a slight uptick, 271 in SA Health COVID positive at the moment, a further 535 furloughed. But as I said to you a couple of days ago at the press conference, those workers that are furloughed, most of those are still able to work remotely from home. So we put a lot of those if you like, protocols for working from home in place some time ago. They're working particularly well, and they're supporting our community response team, supporting those people that are living with COVID in the community. And so, if you like, it's still an important number, 271 who are COVID positive and those that are furloughed, but a lot of them are continuing to work, but work from home remotely.
Can I just ask you, there's some new quarantine rules that were released by SA Health this morning, which stated that if you can't quarantine properly with a COVID patient, you must do 14 days in another facility or another location. Can you run us through what these new rules are?
So what is the rule that you've seen, Andrew?
So 14 days. So if you test positive for COVID, you must isolate for 10 days, but for close contacts that can't isolate properly, they have to do 14 days. I'm just wondering what...
So this is fixing a problem that was identified some time ago when one family had, I think, up to 40 days that they had to isolate because one would get it and the next one would get it and so on and so forth. So I think Professor Spurrier has put out a new guideline for those people that are all living together, that you just go 14 days from that first infection. I think that's what it's referring to, but I'm happy to follow up with Professor Spurrier.
Why 14 days and not 7 days like a normal close contact?
Because they're very likely to have got the disease if they can't isolate separately. So I'm happy to get her to provide further clarity on that, but I'm 99.9% sure that's what that one was about.
Does that therefore again show how confusing the rules are for the public?
No, I think we're just providing further clarity as we're working through different stages of the disease. Look, you can't write a book on COVID before you know what situation is unfolding. This is unfolding on a daily basis, and we're updating the people of South Australia on a daily basis. And as I said only a few moments ago, we will have a change to the use of rapid antigen testing for close contacts. As we get further towards the peak, we want to preserve that PCR capacity for those people who have symptoms so that they can get through in a rapid rate. At the moment, I think we still have the highest per capita PCR testing in the country, and I still think we have the lowest turnaround time, but we've got to be mindful of where we're going to be in a week's time, in 2 weeks' time, in 3 weeks' time, so putting all of those protocols and procedures in place so that we can preserve that PCR capacity. I was very pleased yesterday when 4 of the private labs went down that SA Pathology was able to flex up and at the same time as flexing up the number of tests that were done to actually reduce the times.
How will those close contacts access the rapid antigen test?
So we'll be giving advice of that in the next 48, 72 hours for something in the next week that will come into play when we're told it's the most appropriate time, but they're likely to be collected. So people will notify SA Health, go online, tell us that they are a close contact. We'll then give them a QR code. They'll go and collect that and administer that that rapid antigen test themselves. So
will it be free?
Yes, yeah. Just as the PCR test is free, so will the rapid antigen test.
Why have you been so hesitant to say you will give out free tests until now?
So I think there's been confusion in the media about this because people were talking about giving away free tests. We've always had free tests. here in South Australia, the PCR test, which has been the most appropriate for where we have been with the disease. And so that same test will be provided for using the rapid antigen test down the track. So I don't think there's any change in position from that. I think the confusion has been maybe some of my political opponents who have been out there saying other states are giving away free tests. They're not giving away free to the general public. They're using them as an alternative to the free PCR test in South Australia. So sometimes I think we just need to focus on the fact that we are sometimes in some states at a slightly different phase in terms of where we are with this disease. Some states may have already overwhelmed their PCR testing capability, so it was more logical for them to move to the rapid antigen test earlier. It hasn't been the situation in South Australia, but we're doing that forward work because it's very likely that we'll need to move to that into the future.
How much should a rapid antigen test cost? In your opinion, what's a reasonable price South Australia should be paying for them?
So we're about to go to the National Cabinet immediately after this press conference, and we've got a full presentation, both in terms of the rapid antigen tests which are going to be used through the public system, as well as those that are going to the general public. The National Coordinating Mechanism has been doing some work exactly and precisely on this issue, so I'll be able to provide a further update after the National Cabinet meeting today.
That rule change for close contact, how has that been communicated? I haven't seen an FA Health email or a police direction change. And how is the general public supposed to know that the rules for close contact quarantine have changed?
Which method?
The close contact quarantine rules.
That Andrew is referring to.
Yeah, this is the first that I've heard of. I haven't seen an FA Health email or a SafeHole direction.
Yeah, well, this is directly in response to the questions and queries that we're getting from people who are close contacts, and so now we provide that directly to those people. But it's also available generally on the SA Health website.
So is that for people who can't isolate
Correct.
in the same house? So if they are able to keep separate in the same house, are they still able to do just the 7 days?
Can you just pull that down a little? Sorry.
If they are able to quarantine in the same house, if they've got separate bathrooms, for example, are they still able to just do the 7 days if they're fully vaccinated?
That's my understanding, yes. So we'll provide that clarity from Professor Spurrier later. But it really is in response to one family going through a bit of an ordeal where that people in the house couldn't isolate, and they just sequentially got it, and it really meant the entire family was out for more than a month. This is unacceptable, so we provided this further update.
Do you think FA Health has a proper grasp on how many close contacts there actually are at the moment? I mean, my mum has COVID at the moment, and she hasn't even heard from FA Health in terms of an interview about
I don't have any information on that, and we don't provide any information on an individual person's.
But are you concerned that you don't have a grasp on how many close contacts there are out there, and that if the rules keep changing, people are not going to be willing to put their hand up?
No, I think one thing I can say is that most people in South Australia are very, very willing to sort of work together. This has been the, if you like, the hallmark of the way that we've dealt with this in South Australia. I think it's one of the reasons why South Australia has done so well compared to other jurisdictions. So we know that in other states there is quite a low level of confidence in their daily test rates, because so many people are just using a rapid antigen test, telling their friends and family that they've got it and working outside of the system. I think the vast majority of people in South Australia work through the system, so that's why I've got a high level of confidence in the data that's being presented.
Can I just ask you, with the introduction of rapid antigen tests to replace PCR tests from next week for close contacts, is that because the rules for 15-minute close contacts unmasked indoors? Is that part of the reason? No,
I think you would have heard a couple of weeks ago I was talking about we were seeing modelling that was sort of suggesting we were going to hit a peak towards the end of this month. We're just trying to get ahead of the game like we have since day one in South Australia, and I know that we will need to very likely make a move to using the rapid antigen test for close contacts down the track. We're not at that point yet, which is absolutely fantastic, but we're going to get to that point. We've got to put all those plans in place, and we'll be able to provide further details on this in the next 24-48 hours, but it will probably be something that comes into place over the next week.
So are the vaccines it's good to see the vaccine message getting through, but we're hearing reports this morning that there was an Aberfoyle Park walk-in clinic that was set up this morning, and people were waiting in line. They had their deck chairs out ready to go. They were told it would be open and walk-ins, but then it didn't open and it hasn't opened at all, and they were all sent away. Do you have any information about that?
No, I'm not sure why they would have been told that. Certainly not something that I've been messaging on. We will be messaging on some new places, which will be new sites, which will be opening up soon, because we do want to get as many people through as possible. Look, we've got a good coverage over South Australia at the moment, which is, I think, absolutely fantastic. It's not just in metropolitan Adelaide, but right across regional and remote South Australia as well. So, you know, there will be an opportunity to flex up down the track, but yeah, I'm not aware of that site opening today.
And also, just on the rapid antigen tests, we're also hearing reports that SA Health staff members are going to pharmacies and supermarkets and buying up rapid antigen tests from there so they can give them to SA Health staff. Are you aware of a shortage?
No, there's no shortage in South Australia whatsoever. Yesterday's press conference, I reported that we were expecting a big shipment in yesterday. It did arrive. We're expecting around 1 million rapid antigen tests for use within the state system every single week from now on. So we're very satisfied with that. So there should be no reason whatsoever for SA Health staff to be going and using them to their settings.
Do you have a message to, I guess, retailers who are increasing the price of them? We heard this morning that someone was selling them online for $40 or $50 for one test.
A retailer or?
Yeah, I think it was a takeaway shop. I think it was a burger bar selling it for $40 or $50.
Look, I've got no tolerance whatsoever for people that are price gouging during this period of time. Look, there is a global shortage on this at the moment, and so we obviously need to be able to make sure that we can get these into the hands of people at a cost-effective price. And that's precisely what we'll be able to do. We just need to get through this little interim period where it's, you know, where demand is greater than supply, but I'm sure that's going to correct fairly soon. But again, after National Cabinet Day, we should be able to provide you with more details regarding that.
Inching closer to the end of school holidays, a lot of nervous parents
yes.
going back to school. Can you give us an update and on the vaccination from 5 to 11-year-olds?
Yeah, so the vaccination for 5 to 11-year-olds begins on the 10th of January, so I know a lot of parents are going to be very pleased about that. From my perspective, I would love to be able to tell parents right now what's going to happen for the start of term 1, but we're still waiting on further information in from the AHPPC, and we're still waiting for further information in from the National Cabinet. So we'll get that information, we'll update parents as quickly as possible. As I said yesterday, it's much better for us to be focused on providing the right advice rather than speedy advice that turns out to be wrong. We want to keep all of our students safe, all of our teachers and support staff within our schools safe, and that's precisely what we'll be doing.
Do you support the Prime Minister's proposal to have them subsidised?
So obviously we've got a National Cabinet which is coming up, it's starting fairly soon, so we'll go to that meeting, we'll be able to provide advice after that. I think what we're doing is considering all and every option to get affordable rapid antigen tests to the people that need them. So we'll be providing ours to those close contacts through our own system probably within the next week, but there are other people that will want them for other reasons, surveillance, before they go to work, before they go and visit somebody, that won't be part of that system. So I think that that's what we'll be discussing today at the National Cabinet.
Will the transition committee be looking at changing that up from 25% to 50% indoors?
No, look, we're not near the peak at the moment, so it's very unlikely to be any relaxation of restrictions in the coming weeks.
We've seen hospital numbers go up again today.
Yes.
Another, I think 23 people in
yes.
hospital. Are you confident that we'll have the 392 beds, extra beds ready to go by the end of the month? We've only got 238 of them, I understand, up and ready so far.
So to keep in mind, some of them are beds and some of them are alternative services like hospital in the home. But as you would have noticed, we've now put the direction in place for elective surgery. So the 393, which was part of our overall $123 million package to prepare for opening the borders to Delta, has been superseded. We've got a much greater flex up now because we've been working with the private hospitals in South Australia, removing elective surgery, which increases our capacity within the public hospital system, as well as taking some of that extra capacity within private hospitals. So I'm very convinced that we've got the right capacity. We're well within that at the moment. Pleasingly, we didn't see ICU go up again today, and we've just got the one person on a ventilator, which is, look, a pretty different situation than we see in other states. That's why I'm very pleased that we've put those additional restrictions in place on Boxing Day.
So what are the numbers now with the extra beds as a result of elective surgery being cancelled? So altogether, all up?
Oh, I don't have that figure for you at the moment. We had a presentation from Dr. Evan Everest, who's one of our Deputy Chief Public Health Officers 2 days ago, and he went through all of the individual LHNs and settings, ICU, ventilator and bed capacity. We're well within our capacity, but we've got to marry that up with what the demand is likely to be, and we've got some further presentations on that later this week.
And what will be the peak number of cases that you keep referring to under the Omicron modelling? Have you got the model?
We don't have a final number at this stage. So we've got the Doherty Institute model. As I've said at a couple of these press conferences, we've been working with the University of Adelaide and some of their modellers who are part of the Doherty Institute for a forecast for South Australia. What that's showing at the moment is that we're still a couple of weeks away from the peak in South Australia. It's then likely to last for a period of time before we start to see those numbers declining down. What we're doing now is putting actual data into the models rather than just having the model that was presented 3 or 4 weeks ago at the National Cabinet. And so we are starting to get those actual numbers in. The pleasing thing is, with Delta, we thought there'd be about 5% of people that were ending up in hospital. We've been working on around 1% in terms of Omicron. The data in South Australia would suggest closer to 0.5%. So there is some upside, but the problem is 0.5 of a very large number is still a very large number in South Australia. And that's why we've got to space those cases out. That's why we put those restrictions in place, and that's why we're asking people to go and have that vaccination.
Do you have a ballpark figure?
Not for presentation today, no.
Premier, there's under 30s. People under 30s have a high rate of infection, yet have quite a low rate of vaccination.
Say that again, sorry?
People aged in their 30s,
yes,
and 20s and under have a high rate of infection, that have the highest number of infections in the state, as well as teenagers, and have a relatively low rate of vaccination compared to the rest of the community. What's your message to them to try, among the pandemic?
Yeah, so 12 to 17-year-olds in South Australia is a cohort that we're particularly interested at the moment, especially ahead of going back to school. They're sitting at around about 66, 68% fully vaccinated. We'd love to see that closer to 80. So for those students who haven't gone and got themselves fully vaccinated yet, now is the time to do it. There's only a couple of weeks until school goes back, and we know that Omicron is highly transmissible for those people that are not fully vaccinated, but there's also much more likely to be severe symptoms for those people that are not fully vaccinated. So there's some really compelling reasons for 12 to 17s to go get themselves fully vaccinated, and to get their parents to help them get to the vaccination clinics.
Can I ask you about working from home? There's no advice on the SA Health website for business owners. What is your advice at the moment, and is it still work from home where possible? Yeah,
so we announced, we announced some weeks ago now that really the preference was to work from home where possible. Now, this is obviously not possible for everybody, but look, we really do want to sort of reduce mobility around the state at the moment, because we know that's a way of slowing down the spread of the disease. So we had some very steep escalations a couple of weeks ago. We're seeing still an increase in the number of infections, but not nearly at that same rate. If we look at that doubling rate in South Australia, it's out at around 4 or 5 days, very different from some other states at the moment. We'd like to push that out further, because we just don't want all of those new infections hitting at exactly the same time.
Premier, we're hearing a huge number of ambulance shifts are being left unfilled because paramedics have been forced into isolation. What's being done to address this?
Yeah, well, look, it's the stats that I gave you at the top of the press conference. We are seeing a larger number of people who are COVID positive within the SA health system, and of course that includes South Australian Ambulance Service. There's 271 people across the entire SA health network, so a small percentage of those are going to obviously be from South Australian Ambulance Service. Look, the whole national health system is currently under enormous pressure. South Australia is holding up extraordinarily well, but we're going to have these tension points going forward. We're doing our best at the moment to manage each and every one of them.
That's everybody.
Thank you.
Marshall, questions? One second, one second.